Hello and welcome. Today we're diving into a neurological condition that affects cognitive development, intellectual disability, often abbreviated as ID. We'll explore what it is, its causes, how it impacts the brain, and what can be done to help individuals living with ID lead fulfilling lives. Intellectual disability isn't caused by a single factor, but rather a combination of genetic, environmental, and sometimes unknown influences. Genetic conditions, such as Down syndrome, Fragile X syndrome, and Williams syndrome are significant contributors. Problems during pregnancy, including infections like rubella or cytomegalovirus, exposure to toxins like alcohol or drugs, and complications during delivery that deprive the baby of oxygen, can also lead to ID. In some cases, no specific cause can be identified, highlighting the complex nature of this condition. At its core, intellectual disability involves impairments in brain development that affect intellectual and adaptive functioning. While the specific mechanisms vary depending on the underlying cause, ID generally affects synaptic connections, neuronal migration, and myelination in the brain. These processes are crucial for learning, memory, problem-solving, and overall cognitive abilities. The disruption of these processes in specific areas of the brain leads to specific deficits observed in individuals with ID. For example, individuals with Down syndrome often have differences in the structure and function of the hippocampus, affecting their ability to learn and remember new information. Intellectual disability affects approximately 1–3% of the global population. It's important to note that prevalence rates can vary depending on factors such as diagnostic criteria, socioeconomic conditions, and access to healthcare. While it can affect individuals of all races, ethnicities, and socioeconomic backgrounds, certain genetic conditions associated with ID may be more prevalent in specific populations. Early diagnosis and intervention are crucial for optimizing outcomes for individuals with ID, which is why public health initiatives aimed at early identification and support are so important. The signs and symptoms of intellectual disability vary depending on the severity of the condition. Generally, individuals with ID experience delays in developmental milestones, such as sitting, crawling, walking, or talking. Other common signs include difficulties with learning, problem-solving, and reasoning. Adaptive functioning is also affected, which manifests as challenges with daily living skills like self-care, communication, social interaction, and independent living. The level of support needed by an individual with ID will depend on the severity of their cognitive and adaptive impairments. Diagnosing intellectual disability involves a comprehensive assessment of intellectual and adaptive functioning. Standardized IQ tests, such as the Wechsler Intelligence Scale for children, a WESC, or the Stanford Binet Intelligence Scales, are used to measure intellectual abilities. Adaptive behavior scales, such as the Vineland Adaptive Behavior Scales of VBSS, assess an individual's ability to function in daily life. A diagnosis of ID requires significantly below average intellectual functioning, typically defined as an IQ score below 70, and significant limitations in adaptive behavior, both of which must have onset before the age of 18. The diagnostic process often involves a multidisciplinary team, including psychologists, educators, and medical professionals. Intellectual disability is often classified based on the severity of intellectual impairment. These classifications include mild, moderate, severe, and profound ID. Individuals with mild ID may have some learning difficulties, but can often achieve academic success with support. Those with moderate ID require more intensive support for learning and daily living skills. Individuals with severe ID may have significant cognitive and adaptive limitations and require extensive support throughout their lives. Profound ID represents the most significant level of impairment, requiring constant care and supervision. While there's no cure for intellectual disability, treatment focuses on maximizing an individual's potential and improving their quality of life. Early intervention programs, including speech therapy, occupational therapy, and physical therapy, are crucial for addressing developmental delays and promoting skill development. Educational interventions, such as individualized education programs (IEPs), provide tailored support to meet the unique learning needs of each individual. Behavioral therapies can help address behavioral challenges and promote positive social interactions. In some cases, medication may be used to manage associated conditions like epilepsy or attention deficit hyperactivity disorder, ADHD. The overarching goal is to empower individuals with ID to live as independently as possible and participate fully in their communities. While not all causes of intellectual disability are preventable, certain measures can reduce the risk. Good prenatal care, including vaccinations and avoiding alcohol and drugs during pregnancy, is essential. Genetic counseling can help families understand their risk of having a child with a genetic condition associated with ID. Newborn screening programs can identify metabolic disorders that, if treated early, can prevent or minimize cognitive impairment. Promoting safe environments for children, including preventing head injuries and exposure to toxins, is also crucial. Public health initiatives aimed at educating the public about these preventive measures can help reduce the incidence of ID. The prognosis for individuals with intellectual disability varies depending on the severity of the condition, the presence of associated health problems, and the availability of support services. With appropriate support and interventions, many individuals with mild to moderate ID can live fulfilling lives, holding jobs, forming relationships, and participating in their communities. Individuals with more severe ID may require ongoing care and support, but can still experience significant improvements in their quality of life with the right interventions. Ongoing research is exploring new treatments and interventions for ID, including gene therapies and targeted therapies that address specific cognitive deficits. Advances in technology, such as assistive devices and educational software, are also improving the lives of individuals with ID.